Assalamu alaikum everybody. I hope you are all doing well. In this video we'll be talking about a very important aspect in the physiology of the heart, which is known as the pumping regulation of the heart. We'll start our video with 4 very important definitions that we have to make sure we know before getting into the important aspect of this lecture. So let us begin with the definitions. The first definition is a very familiar one, and it is the heart rate, or what is known as the pulse. The heart rate or the pulse is the number of beats the heart beats in 1 minute, and a normal heart rate is between 60 to 100 beats in a minute. More than this range is known as tachycardia, and less than this range is known as bradycardia. And a very important thing to mention here is that sympathetic activity increases the heart rate and parasympathetic activity decreases the heart rate. The second definition is known as the stroke volume, and the stroke volume is simply how much blood is ejected by the ventricle when it contracts. So when the ventricle contracts, if it was the right ventricle, the blood will go into the pulmonary artery, and if it was the left ventricle, the blood is going to go into the aorta. So how much blood goes to the pulmonary artery, or how much blood goes to the aorta after contraction of the ventricle, is known as stroke volume, and it's measured by milli per beat, which is very logical for this aspect. We can measure the stroke volume using a very important mathematical relationship that says stroke volume equals N diastolic volume minus N systolic volume. What is N diastolic volume? N diastolic volume means how much blood has the atria given the ventricles. So this is known as the end diastolic volume, and we can say it in another way by saying that it's the maximum filling of the ventricles. So stroke volume equals the maximal filling of the ventricle minus the remaining blood in the ventricle after contraction. So it's like I'm saying how much blood is in the ventricle minus how much blood remains after this ventricle contract will of course equal the stroke volume. So stroke volume equals N diastolic volume minus N systolic volume, and it normally equals 70 ml. I just mentioned a number, and using a number to measure how good the heart is working is not a very good way to measure it, because people are different and we can have different numbers. So let us use another definition to measure how good the heart is working, or to figure out if the heart has failed or if the ventricles are not pumping properly. This definition is known as the ejection fraction. It will give us a range, and it will give us a fraction, and fractions are better to measure the activity of the heart. Ejection fraction equals stroke volume divided by the end diastolic volume. As we said, ejection fraction means how much blood was ejected by the ventricle divided by the total amount of blood in the ventricle. Ejection fraction equals 54%, and a normal range is 50 to 60%. When I say that a normal range of ejection fraction is 50 to 60%, this means that at least half the amount of blood volume in the ventricle should get pumped at each contraction. What does that mean? This means that if the ventricle is not contracting properly, it will pump less than half of the volume of blood it contains, and then we'll consider that as heart failure. So if the ejection fraction was less than 50%, this patient has heart failure. The last definition is known as the cardiac output. The cardiac output means the stroke volume times the heart rate. The stroke volume means how much volume of blood is pumped at each ventricle times the number of beats in 1 minute. This means the total amount of blood ejected in 1 minute. The total amount of blood ejected in 1 minute is 5 liters per minute, and this is known as the cardiac output. More cardiac output means that the heart is contracting more fastly, or the heart is pumping more. So this is what the cardiac output can tell us about the heart, and this is a very, very important definition. Another thing that we have to mention is that if the heart pumps 5 liters in a minute, these 5 liters are divided based on the body's needs. So The urinary system is given some, the kidneys are given a percentage of this cardiac output, and the digestive system is given some. Each organ system takes a percentage of this cardiac output based on its needs. So for example, if we are at a resting state, the kidney will take 20% of the cardiac output, and it's actually the organ that takes most of the cardiac output. The digestive system will be taking 21% of the cardiac output, and this is very changeable. So if we are exercising, the cardiac output to the digestive system will be much less, and it will increase to the skeletal muscle, and so on. So now we have finished the most important definition. Let us get into the important aspects of the lecture. The first thing we'll be talking about is the stroke volume and what are the factors that affect the stroke volume. Stroke volume is affected by three important factors. The first one is known as venous return, the second one is known as afterload or resistance, and the third one is contractility. To make sure you understand these factors very well, just imagine that I'm asking you what makes the heart pump less blood than normal. The heart would pump less blood than normal if it received less blood. So there's a rule that says the heart gives you what you give it. If you give the heart more blood, it will pump more blood. So stroke volume increases if the heart receives more blood. This receiving of blood is known as the venous return. So there's a law that's known as Frank-Starling law that explains this relationship. It says that as the heart fills with more blood during diastole, it will contract harder and pump more blood during systole. So more venous return will equal more stroke volume. So when the ventricle fills with more blood due to high venous return, it will have more preload, which means that it will have more in diastolic volume. So it will stretch more, it will contract harder, and it will give us a higher stroke volume. So the first one is really simple and is really important, and it's known as Frank-Starling law. It's simply known as if the venous return increases, the stroke volume is going to increase. Number two, or factor number two, is known as the afterload or the resistance. Imagine that the ventricle is trying to pump blood away, but the aorta or the pulmonary artery are inhibiting it from pumping blood, or are constricting and telling the ventricle, stop pumping blood, I won't let you pump all the blood away. This is known as the afterload or the resistance. So if the ventricle was trying to pump some blood and there was resistance to that blood by vasoconstriction, this is known as the afterload. So higher afterload means lower stroke volume, and it's represented by the aortic pressure. So higher pressure in the aorta means higher resistance, means higher afterload, and then a less stroke volume. The last factor, or the third factor, is known as the contractility or the inotropy of the heart, and this one is simple. If the heart muscle contracts more, of course it will pump more blood, and if it pumps more blood, it's going to increase the stroke volume. So higher contractility equals more stroke volume. Another terminology for contractility is the inotropy. So higher inotropy equals higher contractility equals higher stroke volume. Always remember that more calcium equals more contraction. So what are the inotropic agents that increase the contractility of the heart? The sympathetic nervous system with its norepinephrine and epinephrine will increase the contractility, and the parasympathetic nervous system will decrease the contractility. There's a very important drug and a cardiac glycoside drug that is known as digitalis. What digitalis does is that it increases the stroke volume by increasing the contractility, based on the fact that higher calcium equals higher contractility. So it inhibits the sodium-potassium ATPase pump, leaving sodium stuck inside, and therefore leaving calcium stuck inside. So intracellular calcium levels are going to increase. Higher calcium equals higher contraction equals higher contractility of the heart, yielding a higher stroke volume. So these are the three factors that lead to a higher stroke volume. Now we are going to mention the effect of different circumstances on the stroke volume and how the heart responds to these circumstances. These two are very important, and many people mix them up with heart rate, with heart contractility. So you have to remember that if the heart contracts harder, it's going to increase the stroke volume. But if the heart contracts faster, not harder, it's going to decrease the stroke volume. Why is that? Because if it contracts really fast, think about it that it's going to leave a less time for the ventricles to fill up, so the stroke volume will decrease. So a slow heart rate equals a higher stroke volume, and a fast heart rate equals a lower stroke volume. When you are exercising, your muscles, especially your leg muscles, are compressing your veins, so they are leading to vasoconstriction to your veins. When your veins are constricting, the venous return to the heart will increase, so the stroke volume will increase. Then the exercise leads to a higher stroke volume. The last aspect is bleeding. When you're bleeding, for sure your stroke volume is going to decrease. Now we have mentioned all the factors that affect the stroke volume. Let us talk about the factors that affect the heart rate. Your heart rate, as we mentioned at the beginning of this video, is how many times your heart beats in 1 minute. And another terminology for heart rate is known as a chronotropy. So a quick reminder, inotropy means heart contractility, chronotropy means heart rate. The heart rate is set by the SA node. So if the SA node fires more, the heart rate is going to be faster. What makes the SA node fire more? The nervous control, the sympathetic and the parasympathetic nervous system. Let me remind you of a very important fact. The heart is an independent muscle that can pump alone, but the sympathetic nervous system and the parasympathetic nervous system only affect how fast does the heart pump, not if it pumps or not. It's just the velocity of pumping. So when we talk about the regulation of heart rate, you should keep that in mind, and remember that the most important control on the heart rate is the nervous control. The sympathetic nervous system is going to increase the heart rate by increasing the funny current and increasing the calcium channels. Now, increasing the funny current means increasing the firing of the SA node, then more calcium influx, and by increasing the calcium channel activity, this also equals more calcium influx. More calcium equals higher firing equals a higher heart rate. The parasympathetic nervous system does the complete opposite. It decreases the calcium. It decreases the calcium amounts. So it allows calcium to go out and increases calcium efflux. How can it increase calcium efflux? By using potassium. So why potassium? Because more potassium, opening of the channels of potassium means more potassium going out, means that we are going to be stuck in repolarization, and this will inhibit depolarization and thus decreasing heart rate. So the parasympathetic nervous system decreases flow by activating the potassium channels and by decreasing the calcium channels. This is the first control. Another control is known as the hormonal control. The hormonal control by the adrenal glands and by the thyroid hormone. Both increase the heart rate. The adrenal glands produce norepinephrine and epinephrine, and this will remind you of the sympathetic activity, and the thyroid hormone will also increase the heart rate. This might remind you of a case known as hyperthyroidism. Hyperthyroidism, the patient has always tachycardia, so this should remind you that the thyroid hormone will increase the heart rate. Another important aspects that act on the regulation of heart rate are age, fitness, and temperature. In a higher temperature, the heart rate would be more. If someone is exercising, of course, the heart will pump faster, and with age and as we grow up, our heart will have less efficiency, and the cardiac muscle is going to be weaker, so the heart rate decreases with age. So if you measure the heart rate of someone who's 20 years old, it will be much higher than the heart rate of someone who's 80, for example. This was a quick overview regarding pumping regulation. I hope you found the video useful, and thank you for listening.